It's a treatment that more and more people are turning to for help relieving joint pain. We're talking about regenerative medicine and stem cell therapy.
Here with more this morning is Dr. James Altizer, the Director of Regenerative Medicine at NeoGenix. Dr. Altizer, good morning. Thanks for being here today.
Good morning, Colleen. Okay. Good to see you.
Okay, what is regenerative medicine and stem cell therapy? Explain it to us.
Well, up until now, all the therapies we've had for arthritis just mask the pain. Regenerative medicine using stem cells is actually the first therapy we've ever had that can actually heal the damaged tissue inside of a joint. It actually helps to regenerate cartilage that's been damaged by time, gravity, wear, tear, and overuse. And it's the first time we've ever had a therapy that can actually change the natural history of arthritis.
What type of joint pain are your customers experiencing as they come in?
Well, a typical patient will have chronic knee pain. They have trouble walking. They can't drive for a long time. Their knees get stiff and achy. The pain wakes them up at night. They have problems going up and down stairs. They have to go one leg at a time, leading with their good leg. They might have chronic elbow pain or shoulder pain. Shoulder pain is a very common problem we're seeing. A lot of rotator cuff strains and partial tears and some arthritis in the shoulder joint. And we see a lot of low back pain as well. So pretty much any large joint that has pain, we see patients with arthritis in their thumbs, their wrists, ankles. Pretty much any joint that you can treat with an injection, you can treat with stem cells.
Okay, Dr. Altizer, I know you offer a variety of options when it comes to joint pain for treatment options. Let's briefly touch on what you call your 3 gold standards. The first is bone marrow. How does this work?
Bone marrow, of course, that's where our blood comes from. Bone marrow has a lot of stem cells in it, of course, and it has different types of stem cells. Aside from the ones that make blood, it has stem cells that also help to make cartilage and other tissues, which is exactly what we want when we're trying to heal a joint. Bone marrow is thin like blood, so it's good for use in small joints like thumbs, wrists, ankles, facet joints in the lower spine, sacroiliac joints. So it's really good also for patients with arthritis in bigger joints where it's kind of a mild case of arthritis. So we can use it in combination with other things, but bone marrow by itself is good for small joints and larger joints that have mild arthritis.
Well, the next treatment option is adipose tissue, better known as fat.
Fat, right.
How does that work?
Well, as I mentioned before, this is one area where us couch potatoes have an advantage over you athletes because we have more stem cells than you do. Fat tissue is a very rich source of stem cells. Once you process it, it's a mini liposuction. We just take out a couple syringes full of fat. That's all we need. We don't need to do a cosmetic liposuction. The fat tissue is rather thick, but it has lots of stem cells. So we save the adipose tissue for large joints, shoulders, hips, and knees. And it's perfect for helping to regenerate the cartilage in those big joints.
Okay. You also offer something called Wharton's Jelly. Tell us what this is.
Wharton's Jelly is an umbilical cord product. It comes from normal live births. The umbilical cords are harvested. It has nothing to do with embryonic tissue at all. This is normal tissue that's normally thrown away after a normal live birth, but this tissue is harvested, it's screened for infection, it's processed. So this is an off-the-shelf product. It comes freeze-dried in a vial, and this has lots of high-powered growth factors, not stem cells per se, but very high-powered growth factors, and this is good for people who don't want to go through a bone marrow or a mini liposuction to use their own stem cells. If they're not particular about that, we can take this product off the shelf, draw it up in a syringe, and inject it into a joint, and they can still get very good pain relief and some improvement in tissue regeneration. It's not as strong as stem cells, but it's a really good option for people who don't want to go through a harvesting procedure.
And quickly, your treatment also includes something called A2M. What is that?
A2M is the newest thing. A2M is a protein that we have circulating in our bloodstream. And what A2M does is it captures the enzymes that break down cartilage. Because knees and shoulders and joints don't have good circulation, the A2M protein in our bloodstream can't get into a joint to capture those bad enzymes that are breaking down cartilage. So we draw your blood, we spin it down, pass it through a special filter that filters out the A2M. We draw it up in a syringe and inject the A2M into the arthritic joint. When it gets in there, it binds and destroys the enzymes that are actually breaking down cartilage. It literally stops the arthritis. It's only temporary, but it's a great treatment initially to help prepare the joint for the stem cell treatment that we would then do several weeks later.
It's fascinating stuff, isn't it? Listen to this. NeoGenix has a special offer for Charlotte Today viewers this morning. The first 20 people who schedule a stem cell treatment will get an A2M injection absolutely free. This is a $1,500 value that's free for those first 20 callers. 704-727-6551. Call that number now to take advantage of this offer. Again, the number 704-727-6551. You can also visit NeoGenixStemCells.com. Again, NeoGenixStemCells.com. Dr. Altizer, thank you so much.
Thank you for having me.